Okay, so Assalamu alaikum, Bismillah. Thank you again for joining this presentation about Pakistani Society of Medical Genetics. I'm very excited to show you guys what we've been up to in the last almost 4 years. So welcome aboard. It's going to be a great journey for all of us. So let's get started. Next button. Okay, so I'm gonna just get into it with the 15 people that have joined. Thank you again for joining the call. We'll tell you a little bit about ourselves. What have we been really doing to promote genetics services in Pakistan? And what are some of our aims and objectives as a society? Where do we think there are problems and where do we fit in as a solution? And what really is your role in all of this? Why we gathered you all, and want to share a few testimonials with you at the end about, oh, we have a chat, about people who have been working with us and what do they think about the quality of our work. Okay, so again, I want to take a minute to say thank you to the social butterflies of our family in the Bay Area. So thank you, Baijachu, and thank you, Machachi, for putting this together. We would be nothing, and I absolutely mean it, nothing without their support. And so again, here they are, turning up the crowd as per usual. And again, thank you for taking the time, to all of you 15 people that are on the call, to be here and support us, because honestly, I think we're at the stage where we can use some support. You have a lot of other choices how you would be spending your Wednesday evenings with family, friends, TV, relaxing, and you're here instead. So I really appreciate you being here. So just a little bit about ourselves. So we are a tax-exempt 501c3 charity organizations. We are registered in California. 4 people here, yours truly included, are the board of directors, and we are also very grateful to have partners in Pakistan. We have Dr. Salman Kirmani, Dr. Jamal Reza, and Dr. Saqib Mahmood. They're from Pakistan, they practice in Pakistan. And I'll go around the clock on my side, and I'll tell you a little bit about my team. So, you guys know me, I'm Aisha. I've been a genetic counselor for 9 years, and I work here in the Bay Area as a cancer genetics counselor. And to my left is Dr. Rizwan Naeem. He is a molecular pathologist, and he's a fantastic social butterfly himself, and he works at Albert Einstein Medical School in New York. And then under Dr. Naeem is Dr. Ijaz Ahmed. He is a medical geneticist at Kaiser Permanente in Southern California. And then the bottom right corner is Myla Ashfaq. She is a genetic counselor and a professor of genetic counseling at UT Houston. And the 4 of us got together in the summer of 2020, right when the pandemic was starting, and we said, let's do something. We have some time on our hand. Let's do something to promote genetic services in Pakistan. And so really our mission is real simple. We want to be able to deliver affordable medical genetic services to the people of Pakistan. What is our vision? Our vision is empowering individuals so they know how to make those very tough medical decisions for themselves. We want to counsel them in the language that they understand and in a manner that is culturally appropriate. And our mission statement, again, is to just be able to provide medical genetic services through all these different mediums. That includes education, that includes community outreach, that includes research. And so we'll talk a little bit about how we want to accomplish these missions together. So where do the problems lie, really? Problems are, as many of you probably are already aware of these, I'm just gonna go over them briefly. There are no expertise, really. When I say none, the situation is really dire. In the 220 million people that live in Pakistan, there are 2 medical geneticists that are trained. That's it. There are no genetic counseling schools. There are no medical genetics trainings for doctors that want to become medical geneticists. We also have very limited and very cost prohibitive laboratory services in Pakistan. All the molecular testing that is done is sent out from the country. That includes prenatal, pediatrics, cardiovascular, oncology, you name it. All those tests, if they are being done in Pakistan, they're all sent out. There's lack of awareness and there's lack of research. And that's where we need help with campaigns, health fairs, and et cetera. And I'll go into it a little bit more detail. But really, public health awareness of genetic disorders, patterns of inheritance, how do diseases get passed down from parents to children, and how to really remove the stigma about talking about it. So what are some of the solutions that we see as a group? So we have a four-pronged approach. Of course, there will be many other ways of going about doing it, but this is what we have come up with so far. First is really to create a master's degree level training program in Pakistan that can be for the people of Pakistan so that they study there and they help the people in Pakistan. Number two, we think we can really leverage the telehealth market. That is the way to reach masses instead of the old traditional methods of people going to a clinic and finding out certain things. Telehealth is a miracle, and we think there's a lot of good work that could come out of the telehealth scene in Pakistan, especially for genetic counseling. And then, of course, we think that we need to train people on the job. If the training already doesn't exist, if we could create job opportunities for clinic coordinators and people that work in those hospitals where there are a lot of people that are going to seek help for genetic conditions, we can start training people on the job. We can expand it into various different subspecialties, not just the traditional ones that we think of like prenatal pediatrics, but oncology, cardiology, nephrology, et cetera. And number three really is to partner with labs that are actually based in the United States. We have worked in these laboratories. We have partnerships with these laboratories. At least the four of us that are on the board, we can leverage those very strategically, where we can tell the patients, hey, we think you need to do this genetic testing. If you are unable to afford it, let us help with the cost of the test, and let's try to minimize that cost barrier. And we'll go into it in just a little bit on how you guys can play a role in that. Awareness campaigns locally as well as online. So we are constantly working on creating social media posts, brochures, and we're trying to see if we can get our feet inside some health fairs in Pakistan and see how we can have conversations with people in Pakistan to bring awareness about genetic disorders. Okay, so what do we do, and what do we really do best? I think telegenetics is our strongest suit. So Dr. Ahmed and I have been seeing patients on our Thursday nights, Pakistan's Friday mornings. I'll walk you guys through how we do that all. But really, just a gist of it is that we have seen over 250 patients and their families over the last 3 years. And they come in 3 different specialties. So we've seen them in pediatrics, we've seen them in prenatal, we've seen them in cardiovascular. And we'll talk a little bit about how we do that in just a second. We've done a lot of education, and all of it is at free of cost, no charge to whoever wants to watch these training modules and webinars. So we have 19 online courses that are on our website. That includes 2 case conferences. We have done 2 in-person lectures. So when our teammates go to Pakistan, they have been giving lectures at NICH, at National Institute of Child Health, at Aga Khan, and other places as well. We have also done 1 hybrid symposium, and the picture that you're seeing on your screen is of Aga Khan University Hospital in Karachi, and you can't spot them, but I can spot my favorite people right in the center that are our board members, and they went to Pakistan, and we had a very decent turnout and an awesome presentation for a day-long symposium. Like I said again, the idea here is to bridge the gap of knowledge. There's a lot of knowledge on both sides. We have things that we can offer from our end here from the United States, and then of course from Pakistan, they can teach us a lot. And we're just trying to bring experts on the table so that we can have discussions about how to really remove some of those barriers. And then as far as social media concerned, we've been very fortunate to have partnered with some people that are in Pakistan, and that they have helped us in creating some of these posts in Urdu, as well as translations in English. And we're trying to find more partnerships where we can get them translated into other languages besides Urdu. But really, on our Instagram page, if you're not already following us, please follow us. Our handle is GC in Pakistan, so Genetic Counseling in Pakistan. We have 174 followers and growing. We have 23 posts. A lot of them are talking about basic things like what is genetics, and what are genetic disorders, जीनियात क्या होती है, जीनियाती अमराज क्या होते हैं, ये कैसे मुंतकिल होते हैं वालिदैन से बच्चों में. Or we're also recently starting this campaign where every month, if it's like an awareness month for anything, we will create a post for that disorder, and we will try to explain that disorder from the genetics angle, and try to spread the word really about what are these genetic disorders and how can they be passed down. We've also done some research work. We've done needs assessment. We have 3 peer-reviewed papers. One of them is currently in publication, but you can go to our website, psmg.org/publications, and you can look at those. I've written some articles in non-peer-reviewed publications as well, just to bring awareness in my community, in the genetic counseling community here in the US and English-speaking world, obviously. And then, of course, we have a platform presentation coming up at the next National Society of Genetic Counseling. I'm very, very excited about that. It's in September, and we'll have the eyes of the national audience here in the US and Canada that will be watching this, and we'll talk about, again, what is the need for the Pakistani population. I want to bring that to the national level, to, again, bring awareness. So I promise I will talk to you a little bit about how do we do telegenetics in Pakistan. So here's my little flow chart. So we get referrals from providers. Of course, there are providers that are listed on the left side of your screen that you can see. These are the providers that we have connections with, we have worked with. We get referrals from them. Most of them, the largest majority, come from 2 places, and they're both in Karachi. One of them is the National Institute of Child Health in Kurangi, and the other one is the South City Hospital. And so we get these referrals from these locations, and the patients themselves also send us a lot of emails. So they can go onto our website, they can look us up, and a lot of people have pretty dire situations. And I'll read a couple of those to you guys in just a bit. But basically, you get referrals from those 2 sources: patients themselves sending us emails, or providers sending us these referrals. And then we have a clinic coordinator at 2 sites. One is, like I said, at the NICH, which is a pediatrics hospital, government owned. If you guys aren't familiar with the geography, it's in one of the really low socioeconomic areas in Karachi. And then we also have OBGYN clinic at South City Hospital, where we see patients as well sometimes. And so at those 2 places, the clinic coordinators, they collect all the information from the patient. They send those summaries to us. And then Dr. Ajaz and I, we review those cases, we debrief, and then we see the patient through Zoom. At that time, the patient is present. Their referring providers are present. Dr. Ajaz is present, and I am present. We then have 2 different scenarios. We're either seeing them pre-test, where they haven't had the test yet, but the doctor is suspicious of a genetic disorder. And then there are those where we already know what the diagnosis is. The doctors have already done the diagnosing, they've already done the testing, but they don't know how to counsel them properly. So we see them in both scenarios. Majority of them are coming to us in post-test settings. And then we talk about the order, if the order hasn't already been placed. Like I said, almost all of the testing that's done in Pakistan is sent out. So we have connections, or we've made connections with a laboratory by the name of Invitae in California, and these samples are collected in Pakistan, and then they're shipped to Invitae to do the testing. Patient payments are done through credit cards that they take care of in Pakistan. We don't we haven't gotten involved in that part just yet because we really don't have the funds. And that's where you guys will come in just a little bit. I know you're itching to find out more about that. Okay, so per patient, they provide their credit card information to the clinic coordinator, and then 2 weeks or 3 weeks after the sample is sent to the laboratories, they get the results back, and then there's follow-up for the patient. The clinic coordinator connects with the patient. We get involved, again, for the post-test setting. And again, I just want to mention a couple of big names. We are working with Shaka Khanum in Lahore. We're working with Children's Hospital in Lahore. We're working with Ala Khan and ICH in Karachi, South City Hospital, Dow University, NICVD. I don't know if you guys are familiar with NICVD. They do wonderful work in cardiovascular disease in Karachi. In Dera Ismail Khan, we're working with, or at least not working with, we're connecting with the Goma University. They are the only ones that currently have a rudimentary genetic counseling course that they're offering, so we're working with them. And in Islamabad, we have the Al Shifa Hospital, who is in communication with us, as well as NAMS. Okay, so why should you care? Well, if you don't know anything about genetics, remember this, that as compared to other populations around the world, Pakistanis are very highly homogeneous. We are very, 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 very similar genetically. So by you helping someone, you're really helping yourself. And I just wanted to bring your attention to this. I forgot to take out the graph on the left, so I'll ignore it for now. But the one on the right, if you look at the ratio, it's a staggering difference between the incidence of certain diseases. And these are all genetic disorders, by the way. So if you look at the hereditary neuromuscular disorders that affect neurons and muscles, we're looking at 91 out of 100,000 individuals born. Is the actual incidence in the Pakistani population. But if you look at the other European populations, you can see that there's a staggering difference. 28 out of 100,000. If you look at inborn errors of metabolism, there's a vast, vast difference. The 314 children out of 100,000 children that are born in Pakistan are diagnosed with inborn errors of metabolism as compared to only 26 in the European population. So you can already see where that huge difference is in the incidence rate. So what is the bottom line? Where do you guys come in and how can you help? So basically, you can see the top right graph is showing the different dollar values for different size panels. Oh, something is missing here. I'll tell you what this is. So starting from the smallest and the most cheapest panel that, or test, I should say, rather, that's available, it's called NIPT. That's the one where when a female is pregnant and there's some ultrasound findings and doctors want to know, could the patient have one of these few genetic disorders like Down syndrome, Turner syndrome, or Patau syndrome or Edwards syndrome. So that's the test that is ordered. It's a blood test. It's the non-invasive test. That's the cheapest test that's available. Then we're talking about carrier testing. Carrier testing is the test that you would offer somebody who is trying to conceive. This is usually done in the prenatal settings, but sometimes also in the postnatal settings. But what this does is that it screens for like 300 genetic disorders or sometimes 400 genetic disorders, and it's looking to see if somebody who themselves are not affected can have a child with that disorder, right? So that's where that test comes in. It's called carrier testing. Then you have adult panels. So an individual is, grown up, they're over the age of 18, and now they're showing signs and symptoms of certain disorders that can be inherited. That's an adult panel. We're looking at close to a $400 value for that. And this is out of pocket, not insurance included, right? And then we have prenatal panels. So you can select the number of genes that you want to test for. And those selected number of genes are close to $500, sometimes much, much higher, depending on what lab you go to. So just remember, these are average numbers. So if you find something that is higher or lower, these are just average numbers. And then the last one, the highest cost, which is missing here, is the whole exome sequencing or whole genome sequencing. That means you'll look at all of the genes that have been studied, and we will be able to then identify really in those cases where there's a really, really bad, like a diagnostic odyssey, they've exhausted all of their other frontline tasks, in the clinic setting and can't figure out what's wrong with the kiddo or what's wrong with the person, they'll opt for the big test. Now, why should we care? Why should we want to do this? Well, again, look at the bottom left graph. If you look at the diagnostic yield, these tests tend to have the highest diagnostic yields in Pakistani population. So if compared to somebody who does this, I'm just going to give you an example. So if there were 100 people that did the genetic test in Latin America, maybe 15 of them will find out what's wrong and will have a diagnosis. Compare that to somebody in the Pakistani population. There were 100 Pakistanis that did one of these tests. The diagnostic yield is greater than 50%. It's touching close to 60. Right? So 60 out of, or 55, let's say, out of the 100 people will have an answer after doing a genetic test. So that's the comparison. We all know, I'm sure, especially the doctors on the call, know about the therapies that are out there, the gene therapies that are there, that all came about because we were able to test a flood of people and we're able to generate that much data so that those clinical trials can proceed, so that those drugs can become available in the market. And SMA, DMD are the prime examples, but we also know about PARP inhibitors for individuals that are getting treatment for breast cancer, ovarian cancer, pancreatic cancer. All of that came about because of the flood of testing that's been going on in the Western world. Okay, so I want to talk a little bit about some testimonials. I know I'm running out of time, so I'll do it kind of fast. But basically, the point is that this online education is working. We have had a few individuals that have done this. They think very highly of it. Of course, these are lectures that are done by disease experts, so the quality is really, really high. So this person really wanted to give us kudos and to our team really to put these lectures together because they're benefiting from that. This was a hard one for all of us. It was one of the first actually patients that I saw in Pakistan. It was a lady who came with her 18-year-old daughter who had Turner syndrome, and she had no idea what was the reason for her daughter's illness. So if you don't know about Turner syndrome, it's a disorder where a person's kind of skinny, can't gain a lot of weight. They tend to be they have a lot of challenges mentally, but they also are typically infertile. So the fertility is a big concern for them. They also have some endocrine problems as well. So this mother who has always been told by doctors, neighbors, घर वाले, खानदान वाले, everybody कि तुम अच्छी माँ नहीं हो, तुमने अपनी बेटी को खिलाया नहीं, तुमने अपनी बेटी को अगर ठीक से खिलाया होता या जब तुम प्रेग्नेंट थी तुमने अच्छे से खाना खिलाया होता, खुद की अपनी खुराक सही रखी होती तो तुम्हारी बेटी आज ऐसी नहीं होती. And obviously we talked about it because Turner syndrome is not inherited. Turner syndrome is a genetic condition, but it isn't something that gets passed down. So we talked about it with her, and at the end of the conversation, जो हमारी channel coordinator थी उसने जब उससे बात की माँ से, तो she had some really touching words to share with us, which was, for the last 18 years in my daughter's life, I felt that I was a bad mom, that I didn't feed my child. But today I'll go home feeling heard by the doctors, by my daughter will know that I'm a good mother. That was pretty touching, and I think moms on this call can relate to that. We've also had some really awful emails that we've received, and gets pretty dire. This mom emailed us. She had 3 children that were affected with similar genetic conditions. All of them passed away. She tells us then that she has a brother-in-law who also had 3 daughters who have also passed away because of the same conditions. And then we're talking about 6 babies in this family that have passed away for same conditions. And people don't know what to tell them. And they were really begging us to give them any answers. Oh, hi. So we have someone on the call that is not muted. Okay. Thank you for muting. Thanks. We've also gotten some emails where they're really just asking for financial assistance. They're saying, please help us. We know what this is. We are educated, but we're from lower middle class. This person actually had seen a genetic counselor in the US, or a relative had seen a genetic counselor in the US and told them back in Pakistan that जीनियाती मसला होता है, ये congenital myopathy होती है, और ये cousin marriage की वजह से होती है। तो क्योंकि तुम लोग की cousin marriage है, तुम लोग जाओ और अपना टेस्ट कराओ। लेकिन पाकिस्तान में बहुत महंगा था, they can't afford it. They wanted us to help them just financially to find assistance on how to do this stuff. Okay, this is a stock image, this is not real people, but this is another type of email that we get from all over the world, actually. This is a genetic counselor that I know really well. Oh, sorry. Hi, guys. Can I ask you to mute yourself, please? I can't. Oh, wait, I can't.
Aisha, as an admin, you can mute everyone.
Yeah, I just did. Thanks, Rizwan. I just did. Okay, so yeah, so this person who is a genetic counselor wrote to me, and she said that I have a patient here in California who tested positive for this really, really awful genetic disease. It's called familial adenomatous polyposis, and there's a gene called APC where the person has this genetic condition where their entire colon is full of polyps. The only way to help them is by removing their entire colon. It's called a complete colectomy. And so they said, how do I help my patient's family in Pakistan? They live in Lahore. We were able to provide them with the connections that we have and get their family members tested so that they can be screened from this really, really awful, deadly disease. Okay. We had another one from, this person was from New Zealand. They had Pakistanis that were living in New Zealand, and they had found out that somebody had the genetic disorder is called porphyria. It's a disorder where you get a lot of pain. It's really awful. And it can be inherited. And so they were asking how to get the testing done, but they can't afford it. Can we help them with the cost of the test? And so we've done quite a bit. I think now we're stuck where we need funding. We really need the support of the community to help us help the people in Pakistan. So I'll start with that right at 7 o'clock, like I promised. So the website is the easiest way to go donate. Donate as little and as much as you can. Ask me any questions on and offline. I'm really, really excited about where this can go in the future, and I'm here to answer any questions we have. I also want to welcome my team now to the microphone, so to speak. Ijaz, Rizwan, Myla, please unmute yourself. You can say a few words, but please check out our work on our website. Please follow us on Instagram and see how you can help us move this forward. And thanks once again.
In the chat, I have shared a link for donation.
Thanks, Chachi.
Sure, Aisha, excellent job. Thank you for summarizing everything we do so nicely. And I, have been working with Aisha and Rizwan and Ijaz for a few years now, and they are just such devoted and committed and hardworking people. Like we have just been meeting on our own time, once, maybe sometimes twice a week at nights. And we've just been plugging at it in all of these different directions and trying hard to make a change and make a difference in Pakistan via education, research, just connecting with people, developing relationships so that we can get somewhere. And we started in 2020 and now it's 2024. And this is the first time we're reaching out to others. So far we've done everything just by ourselves with our small team. But I feel like now that we have these connections established, we have these relationships, we, have done something to show we're ready at this point to reach out and ask for others around us to kind of help us with our cause and get involved. So great job, Aisha, and thank you for everything that you've done with this presentation and also just with PSMG. And that's pretty much all I want to say.
Right back at you. I just want to say one quick thing. I think that working with the Pakistani population has got to be the highlight of my career. I think that the amount of gratitude that I have when I work with a Pakistani family and give them some kind of closure, some kind of information about genetics just in general, and their eyes bright up and they understand it just makes my day. Honestly, it's the best feeling. I wouldn't trade it for anything.
So this is Rizwan Naeem from New York. And I remember Ijaz Ijaz used to be my trainee. And one day he called and he said that, it's just so boring in COVID and let's see. And we wanted to do something. And then I believe that I met Myla once at American Society of Professors of Human Genetics in Florida. I think it was 21 or 20, something like that. And then introduced by Aisha. And Aisha really is the heart and soul of this organization. So she has carried this organization. We are just supporting her in big picture, but she has done a phenomenal, her passion for this organization, passion to help people in Pakistan is just amazing. And I got inspired every day what Aisha keep doing every day. We thought that we can also reduce the disease burden of autosomal recessive disorders in our population. And that's a very noble cause because yes, we can. Means it is all about giving them some counseling, giving them some education, making them part of it, and asking them to make a decision. We're not telling them to what to do. We're just making them informed that they can make a right decision for themselves. And with that said, I think you have already seen it. We are translating a lot of this genetic information into Urdu language so people in Pakistan can read it and then make an informed decision. But so far as Myla has said, that all the expenses are being carried out by four of us, basically. And now it's a time, if you want to take a jump in deep and do something more significant, we need some funding. And that funding can be in such a way that either you can sponsor a child, say that I want to sponsor Muhammad Farooq, for example, and let's see if he can be tested and counseled. And if he has a genetic condition, his parents can be tested and see if we can avoid another child in that family of the same condition, or at least uh, make an informed decision that the next child will be carrying the same condition or not. So these type of things, and more importantly, we also want to start a counseling program, which partially Ijaz and Aisha and Myla have started. And we have trained at least one person for sure, but maybe two more people are being under training, and they are doing their services. One of that person was hired recently by the Dow University University to help them their genetics program. So this is a candle lighting the candles, and I would say that in addition to what we have done, I want to donate $500 today also for this cause.
Thank you.
And thank you,
That's
Aisha. That's all I want to say.
perfect. Excellent. Thank you. Okay, so we won't take.
I got
hi.
a quick one.
Yeah.
This is Subby.
I
A quick question that I have is, I guess I'm ignorant of the investment required, but just for the sake of knowledge, what would it take to actually have, is there intellectual property involved, which is a restriction, or is it to be able to have these genetic labs in Pakistan? What is that effort? I'm sure it's a big one, but is that scoped, or like with the traditional labs out there, could they be equipped to carry out these genetic testing? Because I'm thinking from the standpoint of $400-500. I mean, it just seems like lifetimes away for people in Pakistan and the general masses. So this is something at the human level. And what would it take for that initiative from a very simplistic standpoint?
I'll take a stab at it, and then Razan, please chime in. So really, the problem is not equipment. In Pakistan, actually, machinery sits that's worth millions of dollars in mega hospitals and universities. There's a huge, it's called a sequencer, that's actually sitting in Dow University collecting dust. No one knows how to use it. There's another place I believe it's in Lahore. Rizwan, please correct me if I'm wrong. I know for sure about the one at Dow University. And it's collecting dust because people can put samples in the machine, but there's a knowledge gap between what the sequencer spits out, what it gives out, and the readout. It's very obviously complicated, but also it's very hard to make it into a digestible report that a doctor can see and be able to diagnose a patient. So that's where the biggest lack is. And we are actually working with some labs here in the US. We started this, but because again, lack of funding, the labs kind of removed themselves for a while, because one of the steps forward is that the sequencing of the DNA gets done in Pakistan. The data gets uploaded to the cloud, and the experts here in laboratories will then analyze the data and produce a report. That is a middle path that can be worked on if we have the funding to work towards it. A great question. Rizwan, please add anything else you can.
So I would say what Aisha was really mentioning is the crux of the problem is that getting a machine, setting up a lab, this is all for profit organizations, right? There are every lab like Aga Khan University Lab, Dow University Lab, and Shaukat Khanum laboratories, for example, and private labs like Chughtai Lab. They all have genetic testing equipments. But the real problem is that as Aisha said, that interpretation and counseling before the test and after the test, that is not optimum. And most of the focus at present in the sequencing machine or genetic testing is cancer, because that's where the profit is, that's where the money is, and that's where some medications are now available for lung cancer, for example, and some other leukemias, for example. But what we are talking about is that how can we can, that's a very different aspect, like somatic changes or changes which are happen in genome after conceived babies are conceived. But we are talking about how can we avoid genetic disorders which are inherited. Some of the cancer genes are also inherited, of course, but most importantly, autosomal recessive disorders. Good examples of those are cystic fibrosis, for example, or X-linked Fragile X syndrome, for example, or spinal muscular atrophy, for example. And these are and there are many of those what you call muscular disorders, skeletal muscular disorders, which are very common in Pakistan, as a matter of fact. And they are also because of genetic conditions, and these can be avoided, right? This can be avoided in such a way that if the testing is performed at the right time, you can inform parents that either the baby is a carrier or not a carrier or an affected baby. And that will give a lot of information to that family to decide what is next step in their decision. So yes, what our focus is really to how to educate that, how to tell people that some of these genetic conditions can be avoided, and if the testing is performed, but not the three conditions I just mentioned. For example, there is no such lab in Pakistan who's doing genetic testing on any of these conditions as a program or as an information. And again, the affordability. Most of these conditions are happening, as Aisha has seen it, is people coming from interior Sindh, for example, or remote areas of Pakhtunkhwa and Balochistan and Punjab. These are people who have no clue, and they are just married among their families for generations and generations. And because of this, generations and generations of inbreeding, the autosomal recessive disorders are very common, and we can avoid that by education and by testing. And what we are doing is exactly these two things. Yes, ideally, if there is an entrepreneur, if someone in Pakistan with the big bucks, they have a genetic condition in their family, they can open this lab and they can run these things very easily. And as Asha said, sure, for now, the solution is how can we have a hybrid type of situation where we can interpret this data and let the testing done in Pakistan. Otherwise, yes, affording $500, $800 per family for is not an easy task for Pakistani families.
Yes, I did, and thank you again. I was listening into your presentation, and indeed, you're doing great work. A couple of questions as a pediatrician here in the USA. Is there any newborn screening? Are those done in Pakistan? That's question number one. And number two, and I think you mentioned this. I guess equipment in Dow University. So that's not a private university, right? That's are you talking about? Because I just feel like we all at our individual levels have spoken to people with genetic disorders, and as you said, consanguinity is rampant, whether it be urban or rural, and this is something that it needs mass education. My question to you is, like, this is sort of such an overarching endeavor. Have you thought about maybe, like, is there any data about what are the most common conditions that are like how common is SMA? How can we look for grants? Because I remember there was one, I had one family who are very affected by SMA, and then went around asking for, like, there is treatment available. And I think even spoke to a geneticist at AKU. I'm trying to, I think his name was Dr. Salman. And maybe like partnering with people like because he sounded like he seemed very invested in like SMA, for example. And then if you have this I think one of the things, the take home messages for me is your idea about partnering maybe with Dow University, and using that lab equipment, and then partnering with labs over here, and maybe say, you need to raise X number of dollars to be able to do this, and do a subsidized testing for people in Pakistan. I don't know, because it just seems that this is such a it's such a big issue. No one person or one body can do it, and you'll have to you'll need so many partners for this, right? And like, do you guys have a budget of how much you need? Or are you just thinking doing this like piecemeal, we'll sponsor a child? Or I'm just not clear about what your eventual vision is. And then again, my first question about newborn screening, are there any steps about doing creating a program such as that in Pakistan, if there isn't? Thanks.
Asha, you want to take a step first, then I can follow up?
Yeah. Sure. Okay, yeah. So no, there's no newborn screening. There's no prenatal screening in Pakistan at the population level. The only thing that comes close to that we are aware of is beta thalassemia carrier testing that can be done at the government level. And from what we understand, it's only in the province of Punjab where if a child is identified to have beta thalassemia, they are going door to door, going to the house. These field workers go to the house of the child and tell them, hey, let's do carrier testing in your relatives and mom and dad, and try to figure out who is carrier, so that they know not to marry amongst carriers. That's the kind of very rudimentary-ish stuff that's going on. But there's no.
How about the Fatimid I think it's called. But back when I was in Pakistan, there was I believe it's called the Fatimid Foundation, and they used to handle a lot of kids with
Yeah,
thalassemia.
with thalassemia. So they
Okay.
do brief counseling, but that's not population-wide newborn screening. There's obviously there's a lot of stuff that's happening in Lahore. The Children's Hospital Lahore is doing a lot of really good work, but it's not population-wide. Number two, to answer your question about where do we see ourselves? This is baby steps. This is step minus 500 at the moment, I would say.
Yeah.
We're not even crawling at this moment, right? But with baby steps, right? The first step is to sponsor few tests so that we can get a buy-in from the doctors in Pakistan, so we can get a buy-in from the patients in Pakistan that, okay, you don't think that this information is of value to you because you think there's a financial barrier to you. Let's remove that financial barrier. Then let's see if we could get you testing. Let's give you an answer to why do you have 6 children in your family that have died of the same disorder, right? And then, of course, we're with you 100% that we need to come up with a budget. We need to come up with the ideas and present it to our donors at mass scale and say, this is what we're looking at. This is our goal. Today, we don't have a goal. My chachu was asking me the same thing today. कितने पैसे donation के लिए चाहिए होंगे तुम्हें? मैंने कहा अगर $100 भी आ जाएंगे तो मैं तो बहुत खुश हो जाऊंगी. मेरे पास अभी एक भी रुपया नहीं है ना. Like I don't have anything at all. So for me to get there, I need to take baby steps. This is baby step number 1. You're absolutely right in the fact that it has to be done at with a cooperation of public universities, of non-government organizations, and we are a partner in that piece of puzzle. No one entity, no one person can do it. I just wanted to make one more quick comment because my genetic counselor brain is going ding, 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 say something. So I'm going to say that really quickly, and then I'll pass the baton back to Rizwan. So when we talk about consanguinity, we have to be very, 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 very careful and very, very understanding of where that is coming from. Why do we have such a high rate of consanguinity? We are a community of immigrants. We as immigrants understand that when we migrate from a place to another place, there is a very strong connection of keeping our languages, culture, religion going. And the quote unquote outsideness gets very threatening to the way of your life. And so we continue to do that. In Pakistan, we have every few miles a different language, a different culture. It's so much so that people that are a few miles apart can't even communicate with each other because they don't speak the same language or don't practice their religion similarly, et cetera, right? So that's the reason behind it. And then, of course, going back to have a robust carrier screening program at a statewide level so that people know, hey, I want to marry my cousin. I am in love with my cousin. There is a strong affectionate bond that we build as cousins between cousins. But the point is not to say don't marry your cousin. The point is to say, if you're interested, we want to offer you a test that can tell you, is your next generation safe to have no genetic disorders, or at least can we limit the genetic disorders in the future generations? I just wanted to say that. Okay, back to you, Rizwan.
So, you have raised some very, very important points, and I want to address, let's see what I remember. So yes, first step really is to find out what are the common conditions in Pakistan. And for that, we need some budget, we need some institution, we need to collect that data. And the data comes from genetic testing. We have genetic test results for the patients which we have seen and patient gone through us, but there are some other publications, other places. And one of the goal of this organization is also that like there is a panel for Ashkenazi Jewish population, hopefully we can have a panel for South Asian and for Pakistani population, that these are the common variants or common conditions which we have seen it in data driven, and we can address that by testing these conditions. That is one step. Then the second thing you talked about is Dow University, for example, or other university, other labs. They're all for-profit organization. The only not-for-profit laboratory, which is basically a basic cytogenetics lab or fish lab, we call it, is at NICH. And that's where we started. So our partners at NICH keep seeing these patients of autosomal recessive disorders.
Where
And
is
so yeah, just started. At present, we are trying to avoid bank fees because whatever we donated to open a bank account, if we don't have certain amount of money, bank is charging us $15, $20, $30 per month, and that money will be depleted. So at present, we are just trying to survive, and hopefully, in future, we can convince more people and find a major donor who can help us finish these projects. These projects are collecting data, number one. Number two, having a genetic counseling training program in Pakistan.
That we need some sponsors and some base amount of money so that they can run and start doing and establish what they are having their bigger goal.
Yeah.
Thank
Okay.
you.
Aisha, a follow-up on that. A quick follow-up on that is, I guess, is there a next? Do you have a day for, or you want to let us know the next time you want to do this, so that maybe if you can come up with a number that you want to raise, and we can see if we can start that in motion between friends and family and extend that forward, and reach out to our contacts. At least the initial money to even scope the thing. Like whatever you need. So maybe if you want to do a follow-up call in a couple of months or whatever, or based on whatever your schedule is, and maybe we can have something.
So that's a very, thank you for initiating that. So my question is, what do you think? And that's a question for all the audience. What do you think is the best way to make awareness possible to the people who might be interested? And is it in-person type of meeting? Probably is more helpful, more productive, or these online type of things? This was just a start. This is the first time we ever tried to do this. So we don't know what is the best way to do and raise some funds.
I've got a simple one for that. I think the Desi way of WhatsApp group is a great starting point to communicate. At least start off with the people that you have on the call. WhatsApp group, name the group, and ask people to raise awareness and add people. And then you can start whenever you're ready, saying, "Hey, I have a plan. Publish it on there." And then maybe you do a follow-up Zoom call or whatever. Publish it on there. It's organic enough to be communicative to people in Pakistan and in the US, and people that are connected. It just seems to be like the way the masjid communicates and everything else that I know of. And it just seems to work.
I also just wanted to add that, I think like keeping a budget aside that, hey, we're using X, amount of dollars or whatever money for awareness. We're going to educate, and this is our budget for that. And so whoever's the donor understands that this is what's going to, and then we're going to need X amount of dollars for testing or equipment or educate, whatever it is that may be having a budget. And this is the most pertinent, I guess, task on hand. Let's work with that, raise X amount, work with that, get that going. Then the second step, this is the second stage we're in now. Just to kind of have an idea of where this is going. I mean, again, kudos to you guys. I'm very surprised. Every other family I know in Pakistan have this issue. I'm surprised that, we're so far behind, but great cause. I think that even if people in Pakistan should support this, considering there's so many people dealing with this.
All the funds that we collect here stay here. They can't go to Pakistan, and our society, our 501c3, cannot collect money from Pakistan either. So yes, you're right. People in Pakistan should do their own endeavors, and we should help them with the funds that we collect here. What we're doing today is to say that there are so many people out there that come to us and they cannot pay for those tests. And they say, well, I would really like my son to get this testing done, but there's no way I can afford $500 or whatever. And they go away. And it's really hard to keep up with, it's really hard to keep follow up in Pakistan. I'm sure you could imagine. And once that connection is lost, that connection is lost, right? So if we are seeing a patient and somebody comes to us and says, this is the cost that I cannot afford, we have already connected them with the labs. We've already connected them with the expert like myself and Dr. Ahmad, Dr. Naeem, Myla. We're here to help the ground folks in Pakistan. And of course, Dr. Salman Kirmani, I should never forget his name. He is the guy in Pakistan who does genetic testing. So today what we're asking is, can you or others on the call, if let's say I'm gonna make up a number, $100 towards this kind of cause, we will then be able to say, okay, Farah Rashid helped a pregnant person who needed NIPT testing with this cause, right? Like with this test. And so, of course, with that, of course, we will then add more to what exactly you guys are suggesting, which is big timey things like bigger goals, having budgets for machinery and equipment and reagents and like a genetic counseling training program. We have a budget, actually, didn't present it today, but we created one for a grant that we're writing. So we have that. It won't be too hard to put that on video today. It was just not the purpose of the call today. But you're bringing a really, really good point, Bara, and we'll definitely work on that.
What we want to do, Aisha, is that there are 21 people on this call at present.
Yeah.
And of course, there are many others who we know. We can call them friends of Pakistan Society of Medical Genetics, PSMG. Just make a WhatsApp group of PSMG, put this in this PowerPoint presentation there in a PDF format or whatever, easier format. And we can say that, thank you for attending this. And let's see if we can get some donation from those 21 people, for example.
Yeah.
Plus, they open them up that they can talk to anyone they think might be helpful in these type of endeavor, these type of causes. And of course, we all have at least few friends who we can say that, please join us, look at this and see if you like it, please be part of it. So
Yeah.
Friends of PSMG is a new group, which can be as many people as we want. And this can be from people from Pakistan and US be part of it. And we can at least have informational group and discussion group, which can be very, very market-wise. It's a very good idea. Thank you so much. And I think Manan was the one who suggested that. That's a good idea.
Yeah. Awesome. Thank you guys so much for joining, taking the hour out of your precious evenings away from your family and friends to be with us. We are so very thankful to all of you. Please reach out to me individually and we can talk about it at length. I can share so many stories, but just keep us in your du'as, inshallah, and inshallah we'll get there. Inshallah we'll get there. Okay.
So
All right.
Aisha,